Sexual health is an important part of life at every age. And for people over 60, this is no different. In modern society, older Americans are increasingly open to maintaining active and healthy sex lives. However, a worrying fact is that sexually transmitted diseases, STDs, are on the rise in this age group. According to the Centers for Disease Control and Prevention, CDC, the incidence of diseases such as chlamydia, gonorrhea, and syphilis in people over 60 has increased significantly over the past decade. This is not only a medical issue, but also a warning for us to pay more attention to protecting sexual health in the later stages of life. In this article, we'll look at sexually transmitted diseases in older adults, why they're on the rise, and specific steps you can take to protect yourself and enjoy a safe, healthy sex life after age 60. First, understand that sex in your 60s and beyond is completely normal and to be cherished. Many older Americans are in romantic relationships, from long-term marriages to new relationships after divorce or the loss of a spouse. The rise of online dating apps and communities dedicated to seniors has opened up many opportunities to connect and explore love at this stage. However, with this openness comes risks that not everyone is fully aware of. One of the main reasons for the increase in sexually transmitted diseases among older adults is a lack of understanding or complacency about the risks of infection. Unlike younger generations, many older adults were not educated about sexual health when they were younger, and they may think that these diseases only affect younger people. Another factor contributing to this trend is physiological and social changes. After menopause, women are less concerned about getting pregnant, which may lead to less use of condoms or other protection. Similarly, older men, especially those using erectile dysfunction medications such as Viagra, may become more sexually active without thinking about protecting themselves from infections. Additionally, our immune systems weaken with age, making us more susceptible to infection and harder to recover from if we do get it. Older people living in nursing homes or assisted living facilities may also be at increased risk due to the close proximity and new relationships that form in these settings. So what are the common sexually transmitted diseases in older adults? Some notable ones include chlamydia, gonorrhea, syphilis, genital herpes, and HIV/AIDS. Chlamydia is one of the most common, with symptoms such as painful urination or unusual discharge, but worryingly, many cases have no obvious symptoms, allowing the disease to spread undetected. Gonorrhea, similarly, can cause serious problems if left untreated, including infection and damage to internal organs. Syphilis, once considered rare, is making an alarming comeback and can cause nerve and heart damage if not treated promptly. Genital herpes causes painful sores that can recur repeatedly, while HIV/AIDS, despite advances in treatment, remains a serious threat, especially for those who are not diagnosed early. It is important for older adults to realize that these diseases do not discriminate by age. A common misconception is that STDs only affect young people or those who live promiscuous lifestyles. In fact, anyone who is sexually active is at risk, and older adults are no exception. Furthermore, these diseases can be difficult to detect in older adults because the symptoms are often confused with other age-related health problems, such as urinary tract infections or arthritis. This increases the risk of complications, from chronic health problems to serious organ damage. So how can you protect your sexual health after 60? The first and most important step is to educate yourself. Understanding the risks and how to prevent them is key to maintaining a safe sex life. Start by using condoms correctly every time you have sex. Condoms not only help prevent sexually transmitted diseases, but they are also simple and accessible. Don't be afraid to discuss condom use with your partner. Honesty and openness in relationships are the foundation of sexual health. If you find it difficult to start this conversation, remember that protecting both of your health is a top priority. Also, regular checkups are important. If you are sexually active, talk to your doctor about getting tested for sexually transmitted infections. Many, like chlamydia or HIV, can be detected with simple tests and treated effectively if caught early. Don't be afraid to talk to your doctor about your sex life. They are there to help, not judge. In the U.S., health services like Planned Parenthood or community clinics often offer free or low-cost testing, making it easier to get tested. If you are in a new relationship or have multiple sexual partners, regular testing is especially important. Another factor to consider is communication with your partner. Before starting a new sexual relationship, be open about your sexual health history. Ask your partner if they have been tested recently and share your own status. While this conversation may feel awkward, it is an important step in building trust and ensuring the safety of both of you. If you or your partner is diagnosed with an STI, don't panic. Many STIs like chlamydia or gonorrhea can be completely treated with antibiotics, while conditions like herpes or HIV can be effectively managed with medication and proper medical care. In addition to taking personal precautions, older adults can also benefit from participating in community health education programs. Many health centers and nonprofit organizations in the United States offer sexual health workshops or materials specifically for older adults. These resources not only provide information, but also provide an opportunity to connect with others who have similar concerns, which can help you feel more confident in your health care. If you live in a senior living or nursing home community, ask the management if they host sexual health talks or events. Another important aspect is maintaining your overall health. A healthy lifestyle, including a balanced diet, regular exercise, and stress management, can boost your immune system and help your body fight off infections better. Drinking enough water, getting enough sleep, and avoiding unhealthy habits like smoking or excessive alcohol consumption also help keep your body in top condition. If you are taking medication for a chronic condition, make sure you follow your doctor's instructions, as some medications can affect your sexual health or interact with STD treatments. Finally, remember that sexual health is not just about avoiding disease, but also about enjoying the pleasure and connection that sex brings. Don't let the fear of sexually transmitted diseases keep you from living a full life. With knowledge, preparation, and an open mind, you can absolutely maintain a safe and satisfying sex life into your 60s and beyond. Think of sexual health as a natural part of self-care, just like seeing your doctor regularly or maintaining a healthy diet. In conclusion, STDs are a real problem for seniors in the United States, but they are not preventable. By educating yourself, using protection, getting regular checkups, and communicating openly with your partners, you can minimize your risks and continue to enjoy a healthy sex life. The Senior Health YouTube channel hopes that this article has provided you with useful information and motivation to prioritize your sexual health. Share your story or ask a question in the comments below. We'd love to hear from you. Together, we can build a community of seniors who are healthy, confident, and living fully at every stage of life.